My name is Shawna Webster, and I'm the Executive Director of NAPHSIS, the Nonprofit Association of Vital Records Offices in all 57 jurisdictions. Our association's mission is to provide national leadership for both vital records and the related information systems in order to establish and protect individual identity and improve population health. So today, we're here with our outstanding partners, March of Dimes, and the Society for Maternal Fetal Medicine to talk about the improving population health side of our mission, and to share with all of you the myriad of ways in which vital records data are used to improve the health of moms and babies. Today, you'll hear a number of stories about how data is turned into action, and why investment in vital records produces really incredible results. Each one of our speakers today will provide you with examples of how much our vital records agencies accomplish every year, or help to accomplish by getting better quality data, more data, to decision makers and faster than ever before. If you're following us on social media, you can join the conversation at #Vital4a-reason. And we're also live streaming today on our Twitter feed and Facebook as well. So first, a little bit more about NAPHSIS itself and the structure of vital records agencies in the U.S. You may or may not know that the collection of vital records, including information on births, deaths, and other life events, is actually the legal responsibility of the states and not the federal government. Vital records and their data are collected and owned by the states, and access to those records is regulated each by their own individual state laws. And guess what? They're all a little bit different. Surprise, surprise. In most cases, vital records are kept confidential to protect privacy and prevent identity theft. So that's the other side of our mission. But the de-identified vital records become the source for calculating basic statistics on health across the nation, and are also regularly used for medical and health research. So anytime you hear or read a news article that includes health statistics, it's likely that those figures started in vital records. And those statistics help us create targeted, effective public health programs for moms, babies, and families. And maybe even more important, they help us measure the success of those programs. NAPHSIS also plays several critical roles in the national vital statistics system as a whole. We manage national electronic systems that allow states to exchange data with each other and with other public health partners like our friends at NCHS. And we provide leadership development and training for our members. We engage in national advocacy efforts like today's that serve to really educate and inform policymakers and partners about the value of vital records and the statistics that they yield. We also play a critical role with other partners, whether they be state agencies, private industry, foundation, or other parts of the federal government. And that's what I want to highlight in my short time here with you today, and how those relationships help to provide you with a sense of how much can be done with a little amount of resources. So first, I want to talk about a project we have called USA Leap. NAPHSIS worked on this groundbreaking project with NCHS and the Robert Wood Johnson Foundation and produced the first ever health indicator at the census tract level. To statisticians, this is really exciting stuff. This partnership succeeded in geocoding vital records data to produce life expectancy estimates for over 62,000 census tracts. That's not all of the census tracts, but it is the vast majority of census tracts in the U.S. This is the very first data set of its kind. And it's going to allow city planners, health officials, and policymakers to get a far more detailed picture of how small distances geographically can lead to wide gaps in life expectancy and other equity issues. The release of these estimates generated extensive media coverage at both the national and state level, NPR, the Washington Post, Newsweek produced all articles on these estimates, and 23 states had local media outlets pick it up as well. A real success in terms of communication for public health, which we have to call attention to and champion whenever we can. NAPHSIS also provides technical assistance to vital records offices participating in the National Evaluation for the Healthy Start program. And we're on hand to assist vital records offices and or the Healthy Start grantees to address questions and provide guidance on data linkage projects. NAPHSIS is also working closely with CDC's own Division of Reproductive Health, a great partner of ours, to improve the quality of birth and death data exchange between states. And you're going to hear a lot more about that project when Devin speaks to you a little bit later. So this is what I want to emphasize. Investments Congress has made in the National Vital Statistics System over the past 5 years have really made a huge difference. Between 2012 and 2017, the percentage of mortality files transmitted from the states to NCHS within 10 days of the event increased from 14% in 2012 to 53% in 2017. Huge increase, almost 300%. Thank you, yeah, absolutely. That deserves some applause. So just imagine where we're going to be in 2023 with a little bit more resources at our disposal. These are just a few examples of how valuable these investments can be and how this kind of federal and nonprofit partnership can move the needle for data quality and timeliness. So, without further ado, I want to introduce our guest speakers today. Their bios are included in your folders. You're going to hear first from State Registrar and Director of the Bureau of Vital Records and Statistics in the Louisiana Department of Health, and a member of our NAPHSIS Board of Directors, Devin George. After that, we'll have Dr. Jeanette Lewis, Associate Professor of the College of Medicine, Obstetrics, and Gynecology at the University of South Florida. She's also on the Board of Directors of the Society for Maternal Fetal Medicine. After her, we'll have Rebecca Russell from our partners at the March of Dimes. She's Senior Director of Applied Research and Evaluation. And last but not least, bringing up the end there, is Dr. Lou Sadi, the current NAPHSIS President of the Board of Directors, State Registrar of the Office of Vital Statistics in Kansas.